Welcome into Great Day Washington. This segment is sponsored by Well Medica. Aging is a part of life, but it doesn't mean you can't look and feel your best.
And you don't need to undergo surgery to achieve the results you want. So here to explain some non-invasive options for skin rejuvenation is Dr. Dima. We're so happy to have you here.
Thank you. Happy to be here.
Okay, so I like this idea of non-invasive. So if somebody's not ready for plastic surgery, what options do they have?
So besides the usual, which is neurotoxins, Botox, fillers, chemical peels, I think addressing the foundation is the most important thing to do. And that is to rejuvenate your own skin. Your skin has its ability to rejuvenate itself. And so the categories of energy-based devices fall into a couple of different categories: lasers and radio frequency. Lasers use pulsed light to stimulate collagen and elastin. And lasers come in a variety of forms. Each one can treat a specific thing. There are lasers for hair, lasers for redness and rosacea, and lasers to stimulate collagen. And then radio frequency is an energy-based device as well that works a little bit differently. It's a little bit different on the energy spectrum.
Okay. Of all of those technologies, do you personally have a favorite? Is there one?
Yes, I do. I love radio frequency. It's on the energy spectrum in a different area than the lasers are. But it is my favorite because I can treat all skin types with it. And so it doesn't discriminate. It's sort of colorblind energy. And I can treat anything from droopy eyelids to a saggy jowl to female urogenital issues.
Oh, wow.
Wow, it can be used so much.
Yeah.
And so does somebody see something after one treatment, or how does that work?
Many do. I think this is going to be one of the energies of the future that is more preventive. As people find out about it, I think patients are going to get younger and younger because they're going to realize they could almost preserve their cells. But yeah, the more you've got to fix, the faster you see the result. But yes, even with 1 or 2 treatments, you can see results.
I know we actually have photos, right, of 1 session versus 6 sessions, so that you can come back and have more sessions, right? You see more progress in that.
Yeah, for face and neck, it's generally, when it's non-invasive, it's about 6 sessions. So this is a person who had 6 sessions of treatment on her face and neck. And it's often difficult to distinguish that between having a surgical neck lift.
Yeah, that's true at the 6 sessions point, right?
Yeah, so you can actually destroy the fat in the area that you want to. You can, and then you can tighten the skin as well. Now, this person actually needed some fat destruction on their neck, but this was 1 treatment.
Wow.
Yeah, so when you have 1 treatment, though, it's more downtime, and there's anesthesia involved.
Okay.
So the advantage is with non-invasive, yes, it takes more sessions, but there's no anesthetic, there's no recovery.
Yeah.
And you mentioned it can be used on eyelids too. I think we have,
Yes.
Look at that difference.
Yeah, and that second picture is actually taken about 9 months after. This is a lady who is a diabetic smoker. So did not have, the second picture was a diabetic smoker who did not have, was not able to have a traditional blepharoplasty because of her comorbidities. So doing radio frequency non-invasively, that's 6 treatments, is really her only option. And it was starting to affect her vision. Frankly, her wish was to be able to wear mascara, and she couldn't.
Oh, wow.
And so the fact that she has mascara now is kudos to her.
Is there something for people who want to still look natural, like for people to not look at them and say, wait, you've had something done, right? How do you do that?
Yeah, well, the best way to do that is to combine different treatments. So Botox, maybe a little filler, fixing the foundation, the skin itself. We have threads that we can use to lift the face. And so this is an example of someone who had pretty much all of those treatments.
So we're seeing that they can be combined in treatments to get the look that you desire.
I think that, I think knowing that somebody had something done is not the goal. It's to look at somebody and have them look natural.
And you feel good about yourself. Thank you for introducing us to all
My
of this. There's so
pleasure.
many more treatments than we even knew. For more information about Dr. Dima's services, you can head to wellmedica.com. And you can also find her on Facebook, Instagram, Twitter, and YouTube at Well Medica.